Okay, so next presentation is from Samer Hamamji. Samer, you may begin. And judges, after Samer's presentation, there is a break so you can finalize any outstanding items on your scoring sheets.
Hi.
Go ahead, Samer.
Yes, can you see my screen?
Yes, we can.
Thank you. Okay, hello everyone. I'm presenting my study titled The Association of Healthy Food Choices Aligned with Canada's 2019 Dietary Guidelines Recommendations on Cardiometabolic Risk Factors using the Canadian Health Measures Survey. In Canada, over 88% of all deaths are related to non-communicable diseases, including cardiovascular disease and diabetes, and they account for 1/3 of the direct healthcare cost. According to the Global Burden of Disease report, unhealthy diet is still the top 2 behaviorals in Canada, causing both death and disability, and is the major determinant of metabolic risks. To illustrate this point, the term cardiometabolic risk is an umbrella for all the risk factors such as central obesity, high blood pressure, elevated cholesterol, and others that predict cardiovascular disease, hypertension, and/or type 2 diabetes. Some determinants cannot be avoided as advancing age, while others can be modified, such as unhealthy diet. As the burden of diet-related chronic disease is high, Health Canada released in 2019 the new food guide that emphasizes the importance of healthy food choices to develop a healthy eating pattern. It includes 3 food groups depicted in a plate and shifted from serving sizes to one dietary approach for all Canadians above 2 years old. The food guide are combined with Canada's dietary guidelines for health professionals and policymakers, which shapes the recommendations of Canada's food guide into 3 guidelines. The first guideline recommends regular consumption of healthy food choices. The second guideline recommends that processed foods and beverages should not be consumed regularly, while the third guideline focuses on food skills and literacy. The guidelines 1 and 2 were the key references for the development of a food choices assessment score to assess the diet quality in Canadians. What does this study add? One of the most important nationally representative survey in Canada is the Canadian Health Measures Survey, or the CHMS, because it's the only available national survey in Canada that includes direct health measures and dietary assessment based on food frequency questionnaire. Hence, developing a new tool to assess the dietary choices of Canadians based on Canada's Dietary Guidelines 2019 using the CHMS food frequency questionnaire is needed, given that the relationship between dietary choices as recommended in the new dietary guidelines and cardiometabolic risk factors at the population level has not been explored. So, my main research objective is to investigate the association of healthy food choices aligned with Canada's dietary guidelines on cardiometabolic risk factors using the CHMS food frequency questionnaire data. Through developing a food choices assessment score, then validate the score and determine the association with different cardiometabolic risk factors. The result of this association support the construct validity of the score. The CHMS is nationally representative cross-sectional survey. Cycles 5 and 6 were collected between 2016 and 2019. They include data collected through household interviews about sociodemographic status, chronic conditions, and dietary assessment using a semi-quantitative food frequency questionnaire with over 55 questions. In addition to data of anthropometric, physical, and blood measures were collected through the CHMS Mobile Examination Center. Regarding the development of the Food Choice Assessment Score, or the FCAS, first, adults' food choices, as indicated in the food frequency questionnaire, were classified based on Canada's Dietary Guidelines 1 into vegetables, fruits, whole breads, as represent the whole grains, and protein foods that were subdivided into plant-based sources and lean protein foods that are low in saturated fat. Water was considered indirectly as the unhealthy alternative included in the score, and due to large number of missing reporting water intake, and processed food and beverages as in Guideline 2. These all categories form the component of the score. Regarding the scoring reference, unlike the previous Canada's food guide, the 2019 version does not indicate a recommended portion size. Based on that, and after reviewing the literature, we decided to apply a relative scoring method. In other words, the distribution of consumption frequency per week of the score components were divided into quartiles. For food choices recommended to be consumed frequently, the highest quartile was set as a reference category. And for processed foods, the lowest quartile was set as a reference category. Based on that, the food choice assessment score component were assigned a value from 0 to 10 and weighted as the following: 10 points for vegetables, together with the fruits 20, 6 points for plant-based protein, and 4 points for lean protein, because among protein foods, the plant-based sources recommended to be consumed more often, and 10 points for the whole grain breads. To achieve equal weighting of the score, 50% attribute to this component aligned with guideline 1 and 50% for component aligned with guideline 2, with 10 points for each processed meat, processed cheese and ice cream, fries and chips, and sugary drinks with total score of 80. The higher the score, the higher the diet quality. This table presents the component of the score, the points allocated, and the scoring standards. Scores between the minimum and the maximum standards are assigned proportionally. To validate the score, we used construct validity, which means to evaluate the extent to which the food choice assessment score corresponds to high diet quality. For that reason, the FCAS was computed for a sample menu of well-known therapeutic diet for hypertension, or the DASH diet, in addition to a sample menu of Canada's food guide offered by Health Canada. The FCAS component were all at the maximum points for both DASH and Canada's dietary guidelines menu samples, except for the sugary drinks in the DASH diet menu, as it includes 100% fruit juice several times per week, while they are not recommended in the new version 2019 Canada's dietary guidelines. The second type of construct validity evaluates whether the food choice assessment score could distinguish between groups with known differences in their diet quality based on previous studies. Higher mean FCAS was observed in females relative to males, and mean FCAS was higher in older adults compared to younger adults. Daily smokers had the lowest FCAS relative to non or occasionally smokers. Canadians with post-secondary education level were associated with higher food choice assessment score relative to lower education level after adjusting for age, sex, smoking, body mass index, waist circumference, and household income. These results presented here are for Canadians in the highest quantile of the score as higher diet quality relative to lower quantile, using the logistic regression for each of cardiometabolic risk factor after adjusting for different covariates. Canadians in the highest quantile of the score were less likely to be obese by 30% and to have elevated waist circumference by 46% in males and by 52% in females. Similarly, Canadians with higher diet quality based on the score were less likely to have elevated systolic blood pressure by 23% and elevated CRP as an indicator of higher risk of heart disease by 34%. Also, Canadians with higher food choice assessment score were less likely to have abnormal lipid measures, such as elevated total cholesterol to HDL cholesterol ratio by 34% and low HDL cholesterol by 35% in females, with no difference observed in males. And Canadians with higher score were less likely to have abnormal level of blood sugar over the past 3 months, represented by elevated HbA1c by 54%. As conclusion, this study suggests a new and feasible tool to assess dietary choices in Canadians relative to Canada's Food Guide 2019 using the CHMS Food Frequency Questionnaire and provide overview of the social determinants that impact Canadians' dietary choices. This study helped for monitoring the trend of diet quality in Canadians every 2 years using the consecutive cycles of the CHMS or other short version of a food frequency questionnaire, and provides evidence to help public health policymakers create targeted interventions using the new Canada's dietary guidelines recommendations to prevent diet-related chronic disease risk in the Canadian population. Thank you all for listening. I'd like to acknowledge here my supervisor, Dr. Mary Labbe, my mentor for this competition, Dr. Benoit Lamarche, and my advisory committee members and my lab members. Thank you.
Thank you, Samer. So to start off the judges Q&A, Mark, can you please start?
Okay, I actually had a good question lined up, and I think you answered it, Samir, just at the very end there, because I was a little bit confused about something. I guess my question is about further research on this. You're looking at this at a point in time with the, I believe, the 2019 CHMS, and given that we had a policy, not a policy change, sorry, but a change in the Canada's Food Guide in 2019, have you thought about different ways that we can use that change to further inform policy?
Yeah, this is a very good question. Actually, the CHMS, it includes 2019, and as you mentioned, the same year, the release of the new Canada's Food Guide. However, this is the only available or the recent latest cycles available at the population level for dietary intake, and also that include health measures. The good things here also that the CHMS had different cycles, and what's unique or different from other national survey in Canada, that the CHMS it's released with the dietary intake data, with the health measures every 2 years. That will help us also monitor the trend or the change of this diet or the association of diet quality and the health outcomes over the years, also now and later on, and even previously.
Great, thank you very much.
Thank you.
Thank you, Mark. Ramona, you're next.
Thank you, Samer. My background is informatics, so I love a measure that is easily interpretable. I wanted to get to that. Do you see ways in which we could integrate this new measure into potentially technology so it can be at the point in people's hands so that they can use that and interpret it and make changes in their lifestyle?
Yeah, that's a very excellent question. Actually, the first was developing this score. It's at the population level. This is a good point that we have and good data to support. And we are studying the validity of the score, and we have some data so far, and it's ongoing research. We might have different validation methods that also support that score. Now, regarding application of the score at the population level, we can handle that using like application on phones and others that will help. But also, it's what we might have better outcomes. It's if it applied on those vulnerable population or at the population level of Canada. Here, what we have now, some vulnerable population in terms of less or lower HDL or different metabolic risk factors, and also those with lower educational level. So we have this determined. If we applied or not we apply, if we have this data and help us to create targeted intervention, targeted this population first, that will help us to have better outcomes. And also we can, that at the population level, or if we can at the government level, then we can also have different methods to help us implement this score or assess the population at individual level. But of course, it needs different data to support that in randomized controlled trial, in other method of studies to support at the individual level so they can handle it. They use it as, for example, phone application and other to guide them in the new or in the better dietary choices.
Thank you.
Thank you, Ramona. Jeremy.
Thank you, Samer. That's great research. Do you see this when you were doing this work, to follow on from Ramona again, do you see this as research that supports other policy initiatives or leads policy initiatives? Because you've got good research here. It demonstrates that healthy food choices have a benefit over unhealthy food choices, and even suggests some people to target for better food choices. But as Ramona asked, is this something that you envision as something that is used on an ongoing basis, or you just have it as, you know, this supports the work that makes policy with other research as well?
Yes, this is a good question. Actually, this is first, the Canada's Dietary Guidelines or Food Guide is a part of a big umbrella of healthy eating strategy of Health Canada. So this is the first and the only available, if you can say, material released by Health Canada. There is different aspects of food environment also that impact the food choices of Canadians. This is also other aspect of the big strategy of healthy eating. So this score will at least give us an overview or give us some data about the first step of the healthy eating strategies about Canada's food guide. Then based on that, we can see, based on the vulnerable population, based on social determinants, can see what also we can, when we apply different steps in terms of food environment, like the food packaging and others that control the food retails, like in sugars and sodium and other strategies, other part in the healthy eating strategy. So we have now better data to go on for further studies. And I'm working in a lab called the Lab in University of Toronto, which is very specialized in this, in the policy, in nutrition policy, and target all the aspects of the healthy eating strategies from food environment. And now we are here. My part is about the Canada's Dietary Guidelines and Canada's Food Guide.
Thank you.
Marian, sorry, I was muted.
Okay, I have a couple of questions. One, do you think of doing this study quite frequently so that you can capture the effect of relative price changes on the food choices? That would, I mean, if in fact you found that price increases had a substantial reduction resulted in a substantial reduction in the choice of healthy foods relative to the unhealthy ones, that would certainly indicate to policymakers that there might be some subsidy or taxation policy implied.
Yeah, thank you so much. This is a very excellent question. Actually, first, if we start by the data, this is very good things because the data also showed that those with lower education level associated with lower income, they might have lower dietary choices in terms of quality. This is good things, and actually there is it's going here in our lab also other research. But the good thing, if I'm going to talk in my research, that the CHMS, it includes dietary assessment using food frequency questionnaire. What that means? The food frequency questionnaire, unlike the other 24-hour dietary record, 24-hour dietary record is very good. It has very detailed assessment of the diet, but the food frequency questionnaire is very simple tool, and it costs less, and the time to do it is less. So what we can do here, what we can benefit from this data, that integrate the food frequency questionnaire of this national survey to other national surveys in Canada that have impact on the household income, has about food price. And also in our lab, we have different data also at the national level that includes the food that's available in the most retailers in Canada, over 65,000 food items with their price. And there are other group now who are working to integrate this score or the dietary choices as recommended by Health Canada with the price and see any differences in that, or whether the association, if you can say.
Thank you. That's very good to hear. I have a second question. Is there any sort of movement to regulate supermarkets so they do not display low quality or negative quality foods in high footfall locations in the store.
Yes, yes, thank you. This is also a great point. Now, what Health Canada maybe very soon will announce a new strategy or new, if we can say, policy called the front of pack labeling. This is a bit different type of my work, but based on your questions, this label, it's called the warning labels, we can see it on the package of this food when we go to supermarket. This is one of the policy by Health Canada. They are going to target this one, and also in our lab, our different researchers did a great research, and they have a lot of data and published about that. And this is also to have overview from the different aspect of the healthy eating strategies, from dietary choices and the environment for the food environment that impact also the dietary choices of Canadians.
Can I just add a comment that, of course, we have all kinds of regulations imposed on cigarettes and some on alcohol, and it seems inappropriate that there aren't very many imposed on healthy foods.
Thank you.
Thank you, Marianne.
Very interesting presentation.
Thank you so much.
So we are running a little bit late. Hugh, you're next, and then we probably have to shorten our break after.
Okay, I'll try to keep it short. Thank you very much for the presentation. I was wondering, you mentioned there was other data points that, other surveys and other data federally that you could look at. In your research, did you think, I know you sliced your data by smoking versus non-smoking and age. Were there other variables that you thought you could slice that data and come up with some more learnings from that? I know you only have a finite amount of time for your research, but were there a couple, excuse me, that you left off? Is there a regional component to this, like in terms of Canadian regions? I was just wondering if you had that.
Yes, thank you for the question. Also, this is an important point, and we can include it in my research for my PhD research. There is other aspect in Canadian region from some cities, of course, based on the data. We will not have from all the, but it's because it's national studies. They have from different regions across Canada, and also we have for ethnicity other variables that also would impact the health outcomes and also the food habits and food environment. So we have also, as you mentioned, other than smoking, different variables and aspects we can include it in the score, and we have better overview of the association with great or better dietary choices.
Thank you.
Thank you.
Great. So now we're off to our break. We